We had anywhere between 5 to 8 COVID patients admitted to our hospital in late June, heading into early July. But then over the last 3 weeks, we've had 30 or more severely ill COVID patients admitted to our hospital, and currently that number is closer to 40. And the vast majority of patients admitted with severe COVID are unvaccinated. So as of the 23rd of last week, we had 37 patients with severe COVID admitted to hospital. 14 were considered in critical condition. None of our critically ill patients were vaccinated. So in other words, we're seeing very sick, unvaccinated persons. But what's also interesting is the age range. So that age range was anywhere at that point between 23 and 86 of all our severe COVIDs admitted to hospital. But amongst those 14 critically ill patients, more than 40% of them were age 40 or younger. And in the last week, we have had 2 third trimester unvaccinated pregnant persons admitted to hospital with severe COVID who had to undergo emergency C-section. So this is very telling data. This reminds us again that COVID-19 is becoming a pandemic of the unvaccinated. And we know that people who are vaccinated are still going to get COVID. This Delta variant is just so infectious. So we know we're going to see breakthrough cases, and we are. I just told you that 16% of all our positive results through our drive-through testing site last week were vaccinated. But most of these patients are ending up in the hospital. And we just know this. This is largely a vaccine preventable disease. So although we've made a lot of progress, we're just seeing a profound number of unvaccinated persons admitted. Today in our hospital, we do have one critically ill, fully vaccinated COVID patient. They're in their late 50s and they're very immune compromised. So we're going to keep seeing that particular subset of patients, and we are. But the vast majority, again, of these hospitalized severely ill patients are unvaccinated. And the vast majority of them are expressing supreme and profound remorse when they find out how terrible this disease is. Our staff are incredibly exhausted. We have critical staffing shortages. We intermittently are not able to accept transfers. Bed space is at a premium. We've, of course, curtailed elective cases. The health care system is really struggling as a result of this. So, right now, 24% of our inpatients have COVID. This is untenable. This pandemic is impacting us in other ways. I know that my health system is not the only one that is dealing with a critical shortage of blood culture vials. So as of today, we have a profoundly reduced ability to do in-house blood cultures anymore because we just don't have the bottles, because supply chain issues are impacting not just COVID care, but all other aspects of care. That's where we are. And that is shocking to me, and I hope it is to everybody else who's listening. I would also say that we know these vaccines are incredibly effective at preventing severe COVID, and they're largely very safe vaccines. But Delta has changed the game. We know that people who are vaccinated are going to get COVID, but they're at much less risk of getting COVID. I think before Delta variant, what I was quoting was people who are fully vaccinated are 8 times less likely to be infected with COVID and 25 times less likely than an unvaccinated person to get severe COVID or die from COVID. But Delta has changed that math because it's so contagious. So now with the Delta variant, if you're vaccinated, you're about 3 times less likely than an unvaccinated person to get COVID, and about 10 to 15 times less likely to get severe COVID requiring hospitalization. So the vaccines are still very effective in preventing severe disease in most instances. We are going to see breakthrough cases, but the vast majority of COVID infections still are in unvaccinated people, and the overwhelming majority of severe COVID admitted to hospital are in unvaccinated persons, but sometimes in immune compromised people. In my opinion, what's happening is we are asking the immune system of fully vaccinated people to do too much for our communities. And we can reasonably predict that until we get enough of us vaccinated, this virus will continue to mutate as these RNA respiratory viruses do. It will continue to circle back through our community and continue to infect susceptible population for the next 12 to 18 months at these pandemic levels as we try to shove this virus into a more endemic, milder disease.
For the first time during the pandemic, we are seeing huge numbers of sick pregnant women, really sick women. I've been in touch with people, my colleagues around the state. We're seeing ICU admissions, we're seeing maternal deaths, we're seeing babies born prematurely, either to help the mother breathe or to rescue the baby because the mother's hypoxic. And it's really heartbreaking because so relatively few pregnant women are vaccinated. They're much more susceptible. So it's all about, it's 100% right now about the vaccine. Pregnant women need to get vaccinated. We need you to be fully vaccinated. We need you to do it now. It's heartbreaking to spend my day in the ICU taking care of women who are pregnant and may not make it and maybe leave their babies motherless. It's really rough, and it's really rough on our staff. Again, as Mark was saying, we have staff who've been exposed and have to be out, so we're short-staffed all the time. Our staff is stepping up and doing a great job, but they're exhausted and sad. It's just very sad right now.
While people might have heard before, well, we need about 67% or so of us fully vaccinated of the entire population, not of eligible people. Now that math has changed a lot. And so we're now talking about 85 to 90% of people have to be fully vaccinated based on how transmissible the Delta variant is right now. We have to remember that this is a much more infectious strain of the virus. And that is because largely it produces viral titers or amounts of virus in the human respiratory tract that's about 1,032 times higher than the alpha strain, which was much more contagious than the previous strains before that. So Delta has changed the game. And we're starting to see evolving data saying, again, people who have been infected with COVID and had severe illness, if they have severe illness and had COVID, they probably mount some degree of protective immunity. And the likelihood that they would be reinfected over the intervening 3 or 4 months is very low. We have to acknowledge that. But because these variants keep emerging, our immune system isn't adept enough to then provide immunity for the next strain 6 months from now. So we know that the vaccines in general provide a much more robust, durable, and predictable immune response than naturally acquired infection, and also reducing the risk of having to go through severe COVID illness. So as we think about this and as we get ready to potentially starting to have vaccines authorized for younger children under the age of 12, hopefully in the near future, and as we now have a fully FDA approved product with the Pfizer vaccine for certain age groups, these are incredibly powerful tools. But unfortunately, the math keeps changing. And that's because this virus does what RNA respiratory viruses do. It mutates. It just wants to infect us, and it will keep looking for survival advantage for the virus. So we're going to keep seeing this pop up again and again and again until we get enough of us vaccinated.